A bill proposed in the Tennessee House established the framework that would allow medical marijuana on a regulated basis for patients with qualifying medical conditions. Kristen Gallant spoke to some local lawmakers who support this proposed bill. Kristen?
Josh, Representative Matthew Hill and Senator Rusty Crowe have shown their support for the proposed bill. The bill is called the Tennessee Medical Cannabis Act.
Of course, everybody wants to help people. We don't want people to suffer or be in pain. The challenge comes in the details.
Representative Matthew Hill sent out a legislative survey across his district back in February, which asked about the support legalizing marijuana for medical usage and as an alternative treatment for opioids.
My job is to listen to my constituents. It was a question I put in my issue survey, as well as doing my homework on the legislation.
It is illegal for marijuana to cross state lines. It would have to be grown and processed in Tennessee. Senator Rusty Crowe says that's one issue the bill does not cover, along with the proper dosage.
The docs don't know how to dose this. There's so many elements to the THC, they don't know how to dose it. And so if it could just be a script written for a pill, that'd be great. That's not what this is.
Dr. Matthew Palmatier teaches a special topics course at ETSU called Cannabis and the Brain and discusses the neurological effects of medical cannabis.
Part of the reason it's a Schedule I controlled drug is that there is this misperception that it's this highly addictive drug. And relative to the number of people who try it, the number of people who show addiction is way less than alcohol, way less than tobacco.
From a research standpoint, he says it's another medication to have on hand.
People respond differently to different medications, and so having cannabis be legal and have it as an option in the arsenal of things that we might be able to use to treat people would be good.
Under their proposed bill, a person would not be able to acquire, possess, or use a medical cannabis product without a valid cannabis card. A medical cannabis card would be valid for 2 years with the option to renew it once it has expired. Josh?